Assalamualaikum warahmatullahi wabarakatuh. Hi, my name is Muhammad Hasnain bin Hanapi, metric number 139256. I am 4th year student at School of Physics, University Science Malaysia. So today, in this video, I will be sharing with you on a topic which is the coronary angiography. As we all know, our heart did a very important job for pumping our blood throughout our body. Our blood passes through the arteries and veins in order to give the various of important nutrients, hormones, and importantly oxygen to all the cells in our body. For some circumstances or cases, there are plaques or fatty plaques that are consist from the cholesterol that are formed in the arteries. One of the cases is the plaques are formed in the coronary arteries, which is at our heart. The restriction in our heart blood vessels may give us some symptoms of coronary artery diseases, such as the chest pain or angina, shortness of breath, and other symptoms. The full blockages of these arteries may give us the heart attack, which is very deathful to us. So commonly, for the coronary artery diseases symptoms, the coronary angiography, which is a diagnostic test, will be done in order to find the exact location of where the blockages on your heart's blood vessels. This coronary angiography utilizes the X-ray in order to image the blockages in the blood vessels. For those who are familiar with X-ray, you will know that X-ray are used to image the bone in our body. But do you know that we can use the X-ray to see our own blood vessels? But how did they do that?
Interesting.
They uses a special dye, which is a radio pack, or in common terms, we can say that the dye is visible to the X-ray. So when the dye is inserted into our blood vessels, the dye will be visible and the image can be taken, and we could analyze the image to see where are the restriction is. So how coronary angiography is conducted? The coronary angiography is conducted by a special medical team that is assigned for you. During the process or the procedure, you will lie on the X-ray table and you are given sedative to help you relax during the process. Sedatives are given in the form of your IV. Next is the entry site. The thin tube, a small thin tube called catheter, will be inserted from your arm or your groin and then carefully threaded into your heart. After the catheter is threaded to your heart, the dye, which is the dye that is visible to the X-ray, will be injected through the thin tube. Next, X-ray machine will take various of pictures of your heart from various of angles. These images are called the angiograms. These images allows the doctor to see your heart blood vessels and analyze where the restriction or blockages located. So now we have our images and we have located where the blockages or the restriction in our blood vessels. So how do we treat them? We treat them by another procedure, which is the angioplasty. This procedure can be done while after the diagnostic test directly. There are two types of angioplasty. One is the balloon angioplasty and the second one is the stent. The balloon angioplasty pushes the plaque in our blood vessels in order to make room or to increase the diameter for the blood flow. Next is the stent, which is gonna be inserted. They are made of wire gauze. They are inserted and they keep our blood vessels diameter. Same for all the technologies that we have, there must be pros and cons, advantages and disadvantages, right? So for the coronary angiography, there are some advantages that we benefit from, and there are some risks or disadvantages that we need to take into account when doing this procedure. The first advantages of the coronary angiography is they eliminates the needs of surgery. Second advantages is we can know the exact location of the restriction or blockages in the heart arteries. And the last advantages is we can also check our previous bypass surgery that we do and analyze it, which is it successful or not. On the other hand, for the disadvantages, the first disadvantages of this method is the exposure of the X-ray. Due to the exposure of the radiation, there are slight chances of you to get the cancer, but it is normal, and the benefit from the procedure actually outweigh the risk of getting cancer. The second one is the allergic reaction to the contrast material. If you have the allergic reactions for the contrast material from your previous procedure that uses the contrast material or dye, you may consult a doctor before the procedure happens. The last disadvantages is the kidney failure. For the patients who have the coronary artery diseases and also suffers the kidney failures, this contrast material or dye can further the damages to your kidney. In conclusion, this coronary angiography really gives us the benefits. It can save many lives. So if you happen to be the patients who are gonna go through this procedure, worry not. Consult with your doctor. They are specialized in them. Tell them what are you worried about, and consult with them. And there should be no problem. I think that's all from me. Thank you. Don't forget to like, subscribe, and share. Okay, bye.